Good morning. My name is Shannon Lands, and I am the Toledo-Lucas County Health Department Public Information Officer. And I welcome you this morning to the Lucas County COVID-19 briefing. I am going to hand it over to the Health Commissioner, Dr. Eric Skajinski, to provide some updates for the community on COVID and a few other updates in regard to public health. Dr. Skajinski.
Thanks, Shannon. I appreciate that. Thank you, everybody, for showing up today to the press conference. We have a lot to go over, so I hope you can spend some time with us. And I will finish this off by discussing risk levels and where we might be towards the end of the day here. So with that said, you know, we've been doing a lot in the community, public health wise with COVID, but there's many other public health issues that we are trying to take care of, but then also too that we know that we're going to have to really put extra effort in once we can come out of this COVID situation. So it's really important to have a vision, to have a goal, to understand teamwork, and to move things forward for this community. I want to take the time to honor and really thank Dr. Cadigan for what I'm going to announce here. Dr. Cadigan has accepted to be our new medical director, and Dr. Smith. A few weeks ago, we asked that Dr. Smith go ahead and terminate his agreement with us. We did that. The issue here was not at all what Dr. Smith did. He did a fantastic job in a very trying time. We had some issues at the very beginning relative to making sure that we had a medical doctor. He did a great job. But again, we needed to go in a different direction with the idea that, again, there are many public health concerns that we're going to have to address. And what we needed to do is, again, build a team now to be able to, you know, again, address those issues in the coming months. And those issues range from, as we know, physical activity, lack of, for childhood obesity. We're looking at minority health issues and social determinants of health, and all the things we've talked about. So we set on a course to figure out how can we get somebody in to actually help us do that checks off a number of boxes. Let me start off by saying the medical director. For the health department, a medical director just needs to be a medical doctor. So again, that's a checkoff box that's relatively easy. But internally, we needed to have other checkoff boxes. We needed somebody that I felt understood public health. And I'm going to let Dr. Cadigan talk about himself here once I kind of introduce him a little bit. So Dr. Cadigan was a board member for the Ottawa County Health Department. Dr. Cadigan also is a physician in the city of Port Clinton with rights to Magruder Hospital. I'll let him talk to you a little bit about that as well too. He has residence both in Port Clinton and Ottawa County as well as Toledo. He comes with a number of boxes that I was really looking to check off. Those boxes, again, range from a shared vision of what public health should look like. Where do we need to go? How do we build relationships? And then how do we really address all the issues that we have in our community? And knowing Dr. Cadigan for a number of years, both socially and professionally, again, this was a logical choice at this point in time. We did look at other doctors over the last couple months. Just had conversations with them. This unclassified position, we just felt that at this point in time, Dr. Cadigan was a best fit. Again, Dr. Cadigan comes with a myriad of different ideas and possible remedies to some of the issues that we have in our community. Some of the things that Dr. Cadigan and I talked about, again, a new way to actually look at the medical guidance in a community for a public health system. And again, we've talked about this, and I really like the ideas that we both bring to the table relative to that. Such as, we have multiple systems here. Dr. Cadigan is not tied to one system here, and that was important to us. So there is no siloing, there's no bias, there's no perceived individual who is one in one entity versus another. So again, that was important. But the reason why is that we want to build a system in the community where, again, everybody has some skin in the game for public health. So we want to reach back into the hospital systems with the help of Dr. Cadigan to start building that. And what I mean by that, every hospital system has a unique characteristic in this community. So what can they latch on to that we can together, each system individually, move something forward, but yet in a group? So again, University of Toledo has the medical college, and so their skin in the game could be helping us move things forward through the use of students and actually working on research projects and things of that nature. So that could be their gift to the community. Again, this is just a vision. It's going to take us a while to get there. But I think the one thing that Dr. Cadigan and I really want to promote is this idea that just not one doctor knows everything. And that's important. We have so many different issues and crises in our community at any point in time that I believe, and I think what Dr. Cadigan believes too, is that we need to get a group of medical professionals, medical doctors in different disciplines to actually form a think tank for our community that meets once a month, once every 3 months, whatever it might be. Again, we need to plan this out, but actually sit and talk about issues and what is the best path. Again, having those doctors reach back into their own hospitals and their own systems is a force multiplier for us. So there's a lot of great things that I'm hoping that together with Dr. Cadigan, the board, and our staff, that we're going to be able to eventually move things in a different direction for our community. Again, it's a unique way of thinking about it. As with any hire, with any individual, you check off as many boxes as you possibly can. Any gaps or anything, we fill in behind that. So with that said, Dr. Cadigan, would you mind just briefly introducing yourself? I know you have patients to take care of today. But again, he'll be available in the future for further discussions if need be. So Dr. Cadigan, please, if you would.
Good morning. Happy to speak with everybody. I think the commissioner laid out things very succinctly in terms of where we'd like to go from here. Very excited and honored to be able to take part in this position. Just to give you some idea of my background, I am a Canadian trained physician. I've been practicing in the US now in primary care for 25 years. So as we move forward, certainly within the US, whatever our system looks like within the next few years, I feel that I've got a good background in both systems. Whether we end up moving towards more of a national healthcare system or a two-tiered system, the Canadian system is a lot more public oriented that way. In my own personal background, I did serve on the Ottawa County Board of Health. I served as a clinic physician there, as a medical director at a local nursing home. And for the last 7 years until the end of this year, I'm served as coroner in Ottawa County. So I've taken part in disaster preparedness, worked with our local EMA, and we've done a large number of talks and community meetings throughout the community on our other large public health issues, certainly which is the opioid issue. And I've had some discussions already within the health department in terms of some of the programs that we're going to be working with that. I've kind of crossed paths because I've had infectious disease experience through our hospital committees and quality care experience through certification in the hospital committees. And I come from a background in the family of public service. My dad was a firefighter for 35 years. My sister is a public health nurse in Canada. And in terms of my own experience in my practice, I've seen a wide range of people now within the community for 25 years. And I feel that we can work well as a group with the staff of the health department that I've met with so far. I think we've developed a good rapport in moving forward. As the commissioners mentioned, certainly I will not claim to know everything about everything. And I think any provider, physician that claims to know everything in all areas certainly cannot completely understand every facet of medical care and public health. And our goal would be to certainly pull in a consultatory form or a committee form, an advisory group through the Lucas County area, potentially infectious disease physicians with experience in minority health and gynecology in terms of the prenatal care and the early childhood aspect, pulling pediatricians in. So that way we've got a broad spectrum, with myself serving more as a quarterback in that capacity, rather than relying on the knowledge of one person. You know, if we had strictly an infectious disease physician, which is certainly something that would be very important in the times of COVID right now, then we don't necessarily have that experience in dealing with our pediatric issues in our shots for tots clinic, if our prenatal issues in our Healthy Start clinics. And I think we need to kind of work forward outside of the box where we've had one single person doing everything, and kind of pulling the Lucas County community in, the medical community as a cohort to help in public health. I'm excited about it. I've had two kids that have been in school in Toledo, and I've spent a fair amount of the last 6 years, particularly through the winter, at our home in Toledo. As I look forward as to where we go, and particularly as this is the COVID update today, we focus strictly right now, or mainly, on the infectious disease aspect with the COVID-19 transmission. But if we look at where we go after this, how we look back on this whole experience, and how we prevent and deal with such issues in the future, then the highest mortality rates, certainly in COVID, are tied into particularly obesity, diabetes, hypercholesterolemia. There was a large study yesterday in one of the internal medicine journals that discussed the US mortality rates and what those risks are. Those are chronic health and public health issues. Those are things we can tackle and make a difference of, not just for the short term, but in the long term. So the next COVID, the next Spanish flu pandemic comes along, we have a healthier population to step in and tackle that. So, you know, public health is supposed to be, and I think we look at my background, I've been able to tie in enough of those areas to hopefully serve as the quarterback, working in conjunction with the commissioner and the health department to move us forward on that.
Dr. Cadigan, thank you so much. And again, I know from my standpoint, knowing you for so many years, you do openly and honestly talk about issues. You know, there are times that there's disagreements, and that you've worked those out. And so again, I'm really impressed and excited to have you a part of the team, and to see really where we go. Being a trusted physician, but also a trusted individual, is extremely important to any team building, and the truthfulness to the community is what I think this department has been trying to pride itself on, to make sure that we are as informational driven as possible to the community, and let them know what is going on, especially like today with COVID. So I know that I do believe that you're seeing patients today. I would like to have the media take some time right now to ask some questions, but again, please understand
Absolutely.
that media, that Dan, Dr. Cadigan will be available for further discussions if you need him. So
I am certainly, Eric, I'm certainly available as well. I know in speaking with some of the media in Toledo through the coroner's issues over the last 7 years, not all county. I'm sure at a number of these agencies, people realize that generally if they call me, I will get back and speak to you. It may not be immediately if I'm in with patients, but certainly I've told people across the board that if you have questions, you have concerns, you contact me, then certainly towards the end of the day or otherwise, I will get back to you at some point and speak with you with regards to that. And that holds true in the public health aspect of things as well.
thank you, Dan. So Shannon, I think you want to referee some questions here?
Sure. Do any of our media partners have questions? I think Melissa Beach has her hand raised. So Melissa, if you go ahead and ask your question.
Yeah, hi, Dr. Cadigan. It's nice to meet you. Welcome into the coverage for this. The biggest question people are going to have for you is moving forward, what do you see for Lucas County in our response to COVID? What do you see coming based on what your knowledge is of the situation throughout the state?
I would encourage actually all of the media. I'm not sure if you're aware, there is a In terms of a knowledge base, there is an updated reference online available to anybody. Called, if you go to covidreference.com, and there's an international group of experts across all the medical disciplines that update basically a full textbook every 3 weeks on all the updated data. And there's also a daily listing of the top 10 research articles that have come out. The biggest things we're going to see going forward, certainly with the second spike, is how do we lessen this increase we're seeing right now in transmission of infections? And also, how do we then prepare that? Certainly the big question in most families is as kids return to school and we get back into a setting where we have children, which are fortunately not a highly vulnerable population in terms of symptoms, but certainly are a vector for transmission of the disease. How do we make sure that we keep the kids safe when they go back to school? I think the biggest thing right now is the mayor and the council have put forward, and we saw the governor speak about yesterday. There has been a lot of discussion in the last week or two about aerolization of the virus, rather than strictly spreading through droplets through coughing. The virus may actually remain airborne and be infectious, and this has gone back and forth. But we get into the discussion regarding masking, and I think certainly right now that's the biggest thing, is kind of putting differences aside and recognizing that for the health of the community, the most straightforward thing to lower our numbers and to keep your neighbors and yourself safe is, as the governor stated yesterday, is to wear a mask. It wasn't mandated, but certainly given the potential for aerosolized spread through the airway, masking is certainly the biggest thing we can do. The recent number increases that we've seen across the state, including in our area where I am right now in Ottawa County, and that has transferred into Lucas as the neighboring county, is the spread among non-masked people in close proximity, such as in bars. There's been a lot of emphasis and realization that other than the person obviously coughing, you will spread a lot more virus if you're an asymptomatic carrier into the air, if you're taking a deep breath and speaking loudly. And I know when I've spoken to people, I've said, if we're going to, try to move forward and keep the bars and the restaurants open, those are areas where if you're in a bar, you're going to speak loudly in order to be heard above the music and shout at people. We've got to look at how we limit the numbers in terms of exposure in those areas across the state, because we can't just do it on one regional level. And certainly how we limit the volume. So I've been a big proponent of saying that if we're going to keep bars open, we need to keep the music low. It sounds somewhat ridiculous, but if we have low volume to the music, there's less shouting and there's certainly going to be less transmission. But right now we have to look at masking and then making sure that we do careful monitoring of students as they return to school.
Thank you very much.
You're welcome.
Hi, Doctor.
Hello.
I'm with 11.
Okay.
I'm wondering, you're talking about masking, and especially with Governor DeWine's speech yesterday, really enforcing the importance of that. We still have a lot of people who just don't seem to think it works, feel as if it's their right not to wear one. I guess, what do you have to say to them about, why this is important?
Okay. So when we spoke about this, interestingly, in my office this morning, nurses and myself, and when we look at the way the spread has been within the state, there is an online program that tells you, based upon the statistics at present, you can pick any county within the state or the US, and based upon the present numbers, it will tell you this is the likelihood of somebody in your close proximity, if you're in a group of various size, 10, 50, 100 people, what's the likelihood somebody in that group, the percentage risk that you're going to be exposed to somebody with COVID. And those numbers can be surprisingly high, even for smaller counties in Ohio. Lucas, fortunately, has done a very good job in that we are actually lower than a number of the smaller counties. And I mentioned this morning to my staff, we discussed those numbers. And when we started off with all of this, there was certainly the emphasis on the World Health Organization level that masking may not be as important and preventative. And a lot of people still will take that to heart. There's been politicization, unfortunately, regarding what side of the fence somebody's on as to whether you should mask or not mask. And the best I can say with that is the information we have right now is that masking is a benefit. And for those that say, well, 2 months ago, we were saying don't wear a mask. Part of that was to certainly preserve PPE for the people in hospitals and the first responders that needed it. And the other consideration with that is when we start in World War II, for example, the plan we laid out at the first day, the plans that the generals laid out for battle were changed and modified along the way based upon the knowledge obtained at the time. That's true in any military capacity and any military campaign. I would just ask people to kind of look at those type of circumstances and say, at the start of the war in World War II in the 1940s, would we have kept going with the same plan if new information came forward that may point to a change? And I would say we didn't do that. We looked at the information as it came in. The generals looked at that. They modified their tactics to try to best address the situation at the time. This is a fluid situation. COVID-19 is not anything like we've seen before. I've told people over the years, I fear nothing more than a recurrence of the Spanish flu. And this is not the Spanish flu, but it's certainly close to it in its own way. And we're going to have to adjust and modify as this goes along. And although that can bring up finger pointing and concern saying, well, this is not what you told me last week. I will step forward and tell my own patients and people that I've seen that, hey, I may be telling you something different right now, but what I'm telling you right now is based upon the best information we now have, and that I believe is going to keep you safe. And I think that's what we have to look at masking. Yeah, things have changed. And the early thoughts was it didn't make a difference, but we know now it does make a difference. We look at countries with high rates of masking, we see how much lower their numbers are. And we have to look at and accept that everything is going to be fluid. And where do we want to be as a nation as we step into the fall, both from a public health and an economic capacity, because we've got to show the world the leadership in this and say that, hey, we're doing things the right way so that we are safe as well economically for your people to come here to do business with. And that's going to affect all facets of life across the board, whether they're nonprofits, business, for-profits, private companies, whatever. So things will change, and there will be definite changes along the way, like the masking. And I would strongly encourage people, if there are concerns, the information that we're going to discuss at the health department level in Lucas County, we're going to base it on the most updated information we have. And if the information we get contradicts what we said a week ago, but it looks good, then I'm not afraid to step out and say, hey, we were wrong last week. And we admit that what we did last week may have been wrong, but we want to do the best thing going forward for everybody's sake. And that's where
Do you think, last night, I think a lot of people were expecting some closures, a mask mandate. Do you think a mask mandate would help us in Ohio?
I do believe a mask mandate statewide would be beneficial. Unfortunately, there people are still going to have their own opinions. And I think even with a mandate and the fact that may not be legally enforceable, certainly from the policing aspect, I think there will still be individuals that either sometimes for health reasons, but also just personal reasons, will decide not to mask. And if we can at least, though, with a mandate, encourage the majority of people, we will limit spread and get back to our normal more sooner than we otherwise would.
Okay, thank you.
You're welcome.
Shannon, we got about 5 minutes left with Doc. How do we want to work this? You're on mute, Shannon.
That's right.
Okay.
Yes, thank you for that. Melissa, if you have a question, go ahead. And then I believe Dr. Cadigan needs to go because he has appointments he needs to attend to.
Talking to me?
Yes, did you have another question?
Just, you guys are working, you and Eric will be working in concert in a team approach to this pandemic. I wanted you to comment on that.
Yeah.
Yes, I've worked with the commissioner before in other committees, and I believe we work well together. We are, able to be in contact, certainly, regardless of me being in the medical office. The health director position is considered a part-time position. I have been in the office, every Wednesday morning over the last few weeks, and I'm available to be in there on any as-needed basis. Otherwise, certainly I'm available at any time of day, and the commissioner and the staff know that. So if there's anything that comes up, any issues, then I'm certainly available to be on a call like this, even if I'm not on site. And likewise, I'm available to, answer questions from you guys as well if there's something. I've always told people in my practice, I wake up easily, I fall asleep easily. So if it's 10 o'clock at night and somebody calls me, and I'll certainly try to answer things the best I can, and then look up and try to find the details and anything else that we may not be able to answer at the time.
Thank you, sir.
You're welcome.
Doc, hold on one second. I know you got to get off here in a minute or so. Again, I think I wanted to let everybody kind of get a flavor of Dr. Cadigan and really what he's going to really bring to us. But I think we got to look up beyond what we know of Dr. Cadigan and the health department and the team that we're forming right now. I think what I see is the ability to go even further than we could have thought of a month ago with Dr. Cadigan, with the board. Again, with the understanding that now, as we're building a larger team to, again, really address public health issues in our community, we are beginning to see, I think, the team that is hopefully going to really address those severe issues that we have in our community, and again, make us healthier. And that's, I think that's as health commissioner, that is what I need to do. That is my mission. And everybody around me needs to be on that same page, that it is about this community. It's about Lucas County, and it's about wherever you live in this community, wherever you work, whatever you do, wherever you go to school, you are important. And that's where we have to really look. It's a team effort to move the better health of our community from, I think we were 69th last year. We need to move that up closer to 1 on that ranking. So again, you're going to hear more from Dr. Cadigan in the future. He is my medical director, and it's important to understand that he is here to help us and to, again, not only guide, but then also to promote and to understand that he brings something that other people in this department don't have, which is that medical degree. But everybody brings something to the table. So as we work as a team, we're going to have better answers to the problems in our community. So Dr. Cadigan, again, welcome. I think I'll look forward to working with you in the future. And I know we've had a relationship for what's going on now 10 years. And the time that we've talked, it's been enlightening about public health, and I think we've both learned a lot from each other, and I think we're going to continue that relationship here at the department. So I thank you.
And I'd like to emphasize certainly to the media and the press that are there. Again, my ties to Lucas County have increased significantly in the last 6 years. I see the city of Toledo and Lucas County in an exciting aspect moving forward. Obviously economically everything is slowed down, but I think the city and the surrounding area is heading in an exciting direction for the future. We've got to keep our population healthy. My interest in this is certainly, as the commissioner stated, for the benefit of everybody in the county. Across the entire spectrum of helping in the long term, making this healthier. I have a strong interest in cancer prevention. I'm a stage 4 lung cancer survivor now for 7 years. And, the easy thing at that point, once I had that diagnosis, would have been to sit back and say, I don't know what the future holds. Let me, enjoy my time and just kind of sit back. But I feel we can make a difference, and I strongly want to make a difference within this community. And I feel that potential is going to be there moving forward. And if at the end of the day and in 10 years' time, I can look back and say we made a big difference to the people of Lucas County, then I think we've accomplished our job.
Thanks, Dan. All right. So Dr. Cadigan, again, thank you for everything. And again, excited about the team that we're forming.
Yep.
So
we're looking forward to it.
Have a good day.
Okay.
Thank you.
You take care, everybody. Bye now.
Bye. All right, so let's, if you don't mind, I got just a little bit more to go through. Again, I'm really excited to have Dr. Cadigan with us. As you can see that he is really energetic. He's energized about helping this community, and that's really what we need. And again, he's coming in with a clean slate, and that I think is really important. So let's talk a little bit about the governor's press conference last night. Again, I think we've, in this community, I think we do try to take what the governor to heart, and we've done what he's been asking to a certain extent. But again, we got to be able to go ahead and go beyond that and look internally to say, are we doing enough? And I think that was the message yesterday from the governor, is that we as individuals need to, again, wear the face coverings, again, stay 6 foot apart. If we're sick, staying at home. I mean, he's talked about that, but he really is emphasizing that we are in a precarious position where if we don't do something now, we are going to have issues that are we are not going to enjoy those issues that are coming down the pipe. So again, it is really important for us as individuals to wear that face covering, again, do the things that we've been asking. Again, I think it was a great speech, but again, we need to take that to heart. With that said, mask use, you do know that the city of Toledo did pass a mandatory mask use for inside the city limits. And again, we are working on how to implement that. Enforcement is through the Toledo Police Department, but then also we have again skin in the game with this as well. So we're another leg of that enforcement. We'll be coming out with more information. The city will. I know that again, everybody is clamoring to how this looks. I think right now what we need to do is really everybody just needs to wear the face coverings. And as we go through the implementation process, how do we roll this out? How do we get complaints online? Again, we'll work that out. But again, the big thing is start wearing your face coverings. It is extremely important. Excuse me. There is something on the city's website, and I think Shannon will be linking to that as well. I hope some FAQs about the ordinance, so that'll help out as well too. I think we have a screenshot of that. Yes, there we go. And again, it has a lot of the things that I think we're all curious about, and the city's done an exceptional job with this. It does give some exemptions. Please remember that not everybody can wear a face covering, and again, that is really important. There are times where you're not going to be able, you as a healthy adult can't wear one. Again, working out, I don't think that's something that we want to do when we're working out, to be able to wear a face covering, unless it's in a specific situation and it calls for it. So again, please, I direct your attention to the website, and again, a lot of those questions that I think we all have can be answered there. We are going to be looking at using that 419213 4161, and right now it is extension 4 for mass complaints. And again, the ordinance right now is looking at really businesses and making sure that businesses have the ability to state that those entering those businesses really need to wear a face cover. So again, we will have more talk on the face covering issue with the city and the ordinance and any concerns there. I would like to let everybody know that I have been in correspondence. I sent a letter yesterday to city, villages, and township to urge them also to look at a mandatory mask ordinance, so countywide. And again, I think it's important that we all at least have the understanding of why we need to wear the face coverings, and give the cities and townships and villages the ability to, again, talk about it with their community and make a decision. It's so important that we're going to be starting a mask campaign, and I do believe we're going to be starting that today, and it is called Mask Up 419. So I'll put a little tease out there. It'll be on social media and other platforms. So again, just something else that we need to do to be able to get the message out about wearing masks. Last but not least, again, I don't want to keep you too much longer. I want to talk a little bit about contact tracing. We've had this discussion, but again, I want to make sure that, again, I really stress this. Contact tracing has changed since the start of COVID to now. With everything kind of reopening, everybody out and about, what we used to do is one individual used to create 5 other contacts for us. So if we had a positive individual, it created 5 contacts that we had to call. Now one individual could create 10, 20, 30, 40 different contacts that we need to follow up on. And again, we are doing that, but I urge, again, this is another reason why I want people to wear face coverings and do the things we need to do. That is a lot of time, effort into trying to make sure the community is safe. The less contacts that we have to call, again, two things, the better off we are, because again, we know that there's less disease in the community and people are adhering to social distancing. But the more time that we can spend on, again, addressing COVID issues as a more holistic approach too, because as we do contact tracings, we have to expend resources to make sure that those are being followed up on and properly documented. So again, I really want to urge the community again to help us, what Dr. Cadigan was talking about with face covering and COVID, what the governor talked about last night, and what we've talked about for so many days now about the things that we need to do as individuals to make sure that we don't spread the disease into a state where we're going to have to again do things that we don't want to do, whether that's a mandatory face covering or if that is rollback of some of the things that we've now enjoyed since going to the bars and restaurants. So, Shannon, with that said, I do believe that has covered everything that we wanted to this morning.
Yes, Eric, I believe Melissa Veitch has a question. Her hand is raised, so I'm going to ask Melissa to unmute and ask her question, please.
Hi, Eric. The first question I have is how close are we to going to the red warning signal in Lucas County, which would mandate masks for the entire county? And can you describe where we stand with our numbers? Are we still on the upswing? Are we increasing day by day? Are we plateauing? That's the first question.
Yeah, of course, Melissa, thank you very much. I do not have any official announcement of what risk category we're going to be at. Again, come this afternoon. Please note, I will not be surprised whatsoever if we do go red because of a number of things. Again, remember, this is a relatively new process from the governor's office and from ODH, and they're trying to hone this each week. Like any system, you got some hiccups. So again, as we look at the data and how the data gets down, a couple things. One, we are still seeing an increase in cases. We're elevating. We're back to where we were April, May-ish, where we had a number of different days where we were spiking with cases. So we're there. Some of the numbers are in the 40s. We had a 60 positive day last week as well too. So again, though that's a concern. But again, remember, and this is why we've been stressing for so many weeks now, those things to combat COVID, because what happens, you get a 2-week lag time. So we have the younger crowd getting sick, if you would, coming down with COVID. We know that 2 weeks from there, there's going to be another population of our community that's now going to be infected because again, we have the younger crowd coming home, visiting mom and dad, grandma, grandpa, aunts, uncles, who are more susceptible to severe issues with COVID. And I got a feeling we're going to start trending that way. Hospitals, I think, are starting to see some additional cases. Talking with hospitals again, it's nothing to worry about at this point in time. Not like we were a couple months ago, but the hospital systems are so good here in this community that again they're seeing little blips on the radar screen, going, we might have something here. Again, we need to look at more of that data, but again, just thank the hospital systems that we have in this community that are so up on the numbers and the data and what's happening in the community that we're lucky that we could look at those little blips and say what's going on.
Okay, the other question I have is about your response to the governor's speech last night. I mean, a lot of people had anticipated that he would make shutdowns. However, he didn't. Did you get the feeling that this is the warning, the warning gunshot before if we don't straighten up and reduce our numbers, we're going to see some shutdowns?
Again, this is not my professional opinion, if you would, because again, we got to look at numbers and things of that nature. Just personally, I listen to the governor as a father, as a husband, and it really tugged at my heartstrings because again, I want to see my kids go back to school. I don't want to have to see schools closed down. I want to see healthy individuals in our community, and those individuals I don't want to see go go to the hospital with COVID and be put on a ventilator. So that as a person, as a husband, as a father, that pulled at me. Okay, now professional. What he said was spot on. I know a lot of us don't want to wear masks. I hate masks. I've said that before. I'll say it again. I don't like wearing one. I wear it here. I wear it when I'm out and about. I wear it when I go to Kroger's. I wear it when I have to go shopping. Other than that, I am home. My family is home. So professionally, when I'm listening to the governor, I'm saying you are spot on. Again, sitting in the seat as health commissioner, would I have wished that he would have went a little bit further and maybe mandated something? Yes, because it makes our job easier here at the department. But again, he didn't. So now we have to deal with the fact that he's stressing that we need to wear face masks and do the things we need to do to keep our neighbors safe. Why is that? I do believe, Melissa, that he is going to enact something else if we see numbers go too high. I don't know that for a fact, but as we've seen this governor, he is concerned with every individual in the state of Ohio. And so I do believe that he'll do what is right to make sure that we as individuals try to do everything that we can, but if we're not going to do it, then he will step in. And I don't want to see closures. We need the economy to run. But again, if you're walking into a bar, into a restaurant, and it's packed, and they're saying that, we'll seat you here in a second, go someplace else, come back to that bar or restaurant some other time. And when you're at work, again, at work is another issue that we're seeing too. If you're at work, wear your face covering, stay away from people as much as you can. If you have to have a meeting, plan it out so that you're 6 foot apart or use Zoom. These are all things we've talked about, Mel, and again, it just holds true.
One other quick question, and I'm sure it applies. Enforcement of the mask ordinance. What can you tell us about that? Everybody wants to know.
Okay, so let's just look at Toledo's ordinance at this point in time. The idea here is to help those business owners and make sure that those individuals who are going to those businesses and those places that the public can go to have the tools to say, you need to put on a face covering. Again, we're looking at a lot of education here. It's going to be much like at least from the health department's perspective, much like we did with the businesses early on when we had people calling in. We are going to make calls to them and say, listen, what is going on? We had a complaint. Walk through the educational process with them, because let's face it, people don't really understand, face coverings per se in their business, what they need to do, because it is a new ordinance. So again, we want to work with them. Don't pull the sledgehammer out and start beating people over the head because they made one complaint and the owner needs to fix that. Again, there is some power here, but again, you don't want to use it. So as we go on, of course, at some point in time, if individuals in those businesses cannot get their customers to wear those masks, there is the penalty. I think it is $150 for a citation. But please remember, this is really to inform the public and to, again, put some measures of responsibility back on the individual. Say, if you want to go in that store owner has the right to say, you're not wearing a mask, you can't come in. So I think that's the important thing that the community needs to understand.
Thank you. I'm done.
No, thank you, Mel.
Amy, please go ahead with your question.
Yeah, Mel covered most of what I had asked, but I did have one follow-up. I heard you talk earlier, but you kind of cut out for me about looking into a potential Lucas County mandate for masks if we don't go into that red status. So I guess, can you talk a little bit more about that?
Again, that the way political subdivisions work, everybody has their own a different charter, or a different set of, if you would, a different set of rules to follow. And like the city of Toledo they have the ability to again create an ordinance and then have that followed. So cities have that ability, so do villages. Townships are a little bit different. Again, what I'm trying to do is I'm pleading with different jurisdictions in our community. Can we all be on the same page? Really stress the ability to again wear the mask. Make sure that the local jurisdictions, the elected officials have all the tools to make a rash and logical decision about how they go about getting people to, again, wear masks in their community. I would love to see all of Lucas County not have to have a mandate, and we all wear face coverings, those that can. But again, if we can't, then there is that ability to have certain jurisdictions actually create those ordinances.
Bree with the Blade, please go ahead with your question.
Hi, my question is a little bit off what we're talking about regarding masks, but I was wondering if you could speak to just what's going on with our K through 12 schools.
Sure.
I had reached out to Shannon and I learned that it's a recommendation that they work alongside of you guys or present their plans, but I wanted to know your opinion about our schools. Will schools be ready in August to have in-person instruction up to 5 days a week?
That's a great question, and let me just give you a little bit of background, but I don't want to steal the school's thunders. The schools as a whole in our community steal their thunder. We have been working for a number of weeks now. There are weekly calls and sometimes twice a week calls with superintendents and school systems to look at their planning. And so we started early on when the recommendations from both the Ohio Department of Health and, if you would, ODE, Ohio Department of Education, came down and tried to figure out what we needed to do. So again, once those recommendations came down and guidance documents, they've been full bore to get their plans up and running. Now, I will caution everybody. I think as Dr. Cadigan said, and we've said before, the issues that we have today and the guidance we have today might change by the end of the week. We've seen this. So it is a moving target. But if you would, let's talk about the framework of the plan that we have right now. Schools are looking internally. They have to make their best choice of what they need to do to make sure they keep their kids safe. And again, like I said, that is changing almost every day with increased cases. Now it's going to change a little bit more. So some have the ability to go full time for 5 days. Other ones are doing hybrid, if you would. So, 2 days, maybe 2 days in classroom, 3 days out, distance learning. But again, I think what every school system is also doing is, okay, you got plan A, what's plan B? What's plan C? So they got their plan A down, and they're going to be working on plan B and plan C as we go along, as we get closer to actually schools being open. I will caution, going back to your question, I will caution us that right now, yeah, we might be able to open up and go 5 days, but possibly the end of today or next week things change where we can't, or vice versa. Maybe wearing face coverings if everybody can, and in 4 weeks from now, like some of the research says, also we knock the virus down, like the governor said yesterday, we can send our kids to school 5 days. But again, we don't know how that's going to look at that very time. And like I've cautioned every superintendent that I've had the ability to talk to, and they're fantastic individuals, that the scenario is going to drive our decisions, and it could be last minute. So just be prepared to be flexible, and they all are. Again, I think it goes, let me just say this, much like our hospitals and our school systems the same way, they're fantastic. And like we find every aspect of this community, they want to do the right things and they care about this community, and that's so important. And again, the schools are trying to do that.
Thank you.
Sure, thank you.
Sophia, please go ahead with your question.
So it seems like the people that are anti-mask are very much anti-mask, and the people who are pro-mask are already wearing masks. Do you think the speech last night was effective enough to make those anti-mask people change their minds and start wearing masks?
It's funny. My wife and I had that very same conversation last night, and I got to say that I do believe that he changed some people's minds. But I don't think, he changed everybody's that we need to. Again, he was really trying to tug on our heartstrings. I think he was trying to tug on our sense of humanity and try to protect our neighbors, as we always try to do. So again, I don't know how that message got to everybody that might be so far in the idea that they shouldn't be wearing a mask, that if it really broke through them. I do think it helped. I do think that there's a number of people today that are wearing masks that probably said yesterday, I'm not going to wear one. So again, I don't know. We won't know until the next couple of days. Are we going to see more mask wearing on the street because of what the governor said? And that will be the data that we would look at. when you walk into, when you walk into some stores, are you seeing more mask use? Are we actually seeing it to believe it?
Melissa, do you have a question? Your hand's raised.
No, I'm good. I'm sorry. I should have unraised it.
Okay.
If there's no more questions, I do apologize for the length of this, but there was a lot of information. I think Dr. Cadigan today was important just because we don't know where we're going to go in the next couple of weeks. And so again, it was important to make sure there was an introduction there. And again, the mask use is so important. If we find out that our risks are going to change, of course, we'll be available later on this afternoon. Again, we don't quite know what's going to happen with the governor's announcement. So with that said, please stay tuned. And again, we're all in this together, and eventually, like the governor said, this will end. But I think the most important thing is who's going to be here with us when this does end. And again, I think that's so important because some people cannot handle this disease, and it's up to each and one of us to protect them so they are here when this is over.
Thank you. Thank you all for your time, and have a great rest of your day.